One, two, three.
Hello.
Hello. Good morning, everyone.
Good morning.
Welcome to the Nursing School Show.
Ask me anything. I'm Christina.
I am Matthew, and
Nice to meet you.
nice to meet you. Today, we talk, as with every other times, Monday and Wednesdays, we talk about nursing school topics and help you get through nursing school.
And become an amazing nurse.
Become an amazing nurse. The topic of today, how to ace
Care plans.
care plans.
In
That's the
nursing
name.
school.
That's the word for it. How to ace care plans.
Now, how many care plans do you have to write this week? Put a number down.
Oh, yes. Just a number.
Drop a
just
number.
a number. Drop
How
a
many
number.
care plans?
How many care plans?
How many care plans?
And how much is average or normal, would you say?
Great question. I think that typically, well, at least for my nursing school, maybe 2 to 4 care plans per patient that you had at clinical. Now, there's a lot of clinicals that are online, and you can also do care plans for your lecture class. So it will greatly vary, as you can imagine. So, as we progress through nursing school, toward the end of my nursing program, we had more and more patients right on the floor. So then you would have, 3-4 patients, 4 care plans each. It's a lot of care plans in one day. And then you have multiple clinical days. So, it can add up to a lot. But as you're just starting, it's going to be, 1 a week maybe, as you get your feet under you and learn it.
Okay. So it can happen for both lectures and for actual clinicals as well. Okay.
Yep.
Very
absolutely.
cool. So go ahead and shoot a number down in the comments. How many care plans are you doing a week currently?
Boom. Yep.
And is it for lecture? Is it for clinical?
Okay.
Et cetera, et cetera. I am curious. I am not a nurse, not in nursing school.
1.
So I am curious myself. All right.
Alita 1 for clinical.
Very cool.
Alicia at clinical for 3. So yeah, 3 per clinical day or 3 a week. Yeah.
And you said per patient as well.
Yeah, because care plans will be different per patient. They're very patient specific. They need to, tip number 1, make them patient specific. So you'll have a set of them for each patient that you will have at clinical. Yep, per patient. Okay, yeah, per patient, 3 per patient. That makes sense. 1 for each clinical per patient. I'm just assuming. Just started this week writing care plans. Did 1, but it took me all day. I can totally relate to that.
There you go.
Norris, totally
You will
relate.
get faster, I am assuming.
Yes.
I am assuming you're going to get faster.
T. Shondell, not yet, is something that you would normally do in the first semester. Yes, care plans are something that you would normally do in fundamentals class for nursing school. Now, if you are taking like anatomy and physiology, microbiology, and your prereqs, then no, you would not be doing care plans. But if you are in your core nursing school classes, fundamentals, med surg, those things, that is when you will really start to dig into care plans and figure out how they work and all the things. So I'm going to walk you through exactly how to write perfect care plans. And I hope that you save this video because it's going to help you so much. Now, first off, just getting started, the number 1 question we get about care plans is, Christina, how in the world do I find the list of nursing diagnoses? This is huge, friends. If you look in your nursing school textbooks, if you're on YouTube or Facebook, you can see the textbooks behind me. A lot of them have sporadic nursing diagnoses around the textbook. You'll find them hidden at the end of the chapters or what have you. That's fine. It's not great, but it's fine if you want to use your nursing textbooks, regular nursing textbooks, to find diagnoses. The best thing to do, though, is to get a care plan book. And this is the one that I recommend. This is the Nursing Diagnosis Handbook by Ackley and Ladwig. It's on Amazon. I highly recommend that you check it out because it basically writes your care plans for you, and that is not an exaggeration, my friend. I'm going to walk you through this book and how to use a care plan book like this to help you write your care plans in like 10 minutes. If you are spending, Norris, it took me all day to write my care plan. Yeah, that's how it is when you start in fundamentals, when you don't know how to write it, right? It can take you all day, multiple days. But friend, I'm telling you, this book writes it for you. Like 10 minutes, you can do it. It will help you figure it out so much better. And with this, it actually has the whole list of nursing diagnoses in the front 2 pages here. So this is what you need because nursing diagnoses are standardized. You can't just make them up.
Is that what we were talking about the other day with Nanda and Nanda I?
Nanda and Nanda I.
Hooray!
Nanda nursing
I learned
diagnoses.
something.
You know something nursing. Nanda nursing diagnoses. These are what you need to use. You can't just make them up. They're standardized. And so you have to use, however many you need for your care plans, but they have to be from this list. And here's the list. It's in the book. Now, like I said, in your nursing textbooks, like the ones behind me, they will have some of them in there sporadically throughout your chapters that you could find. So if you didn't want to buy this book, that's totally fine. But just like look in your other textbooks to find them. That's fine. It's just not going to be as easy for you is the thing. So that's tip number 1. Please get the book or consider getting the book if, you just want to write your care plans faster.
I would also say that you should definitely get the latest edition for this one, right?
Yes.
Yeah.
This is one of these textbooks that you have to have the latest edition for because they do update the Nanda diagnoses periodically, not frequently. It's not like every year as of right now. Like they didn't just update it like last year. When was this? I think this was maybe last year it came out. And to my knowledge, there's not a new one. So it's like every few years.
From YouTube, Alexis, you have that in your book bundle. That's great.
Perfect.
That's perfect.
Yeah, 2017. So this came out in 2017. Oh, copyright 2020. Okay, so yeah, it's like every 3 years. Oh, it is actually every 3 years. So every 3 years, previous editions. So this is 2020. This is the 2020 edition. Hey, look at me being all like, on top of things. 2020. So it comes out every few years. I would definitely recommend that you get the updated one because they do change and update.
Okay.
Those diagnoses.
Before you dive in, just since we are talking about the book and about the Nanda, Charlotte asks, although they are standardized, you still have to make them individual to the patient's needs, correct?
Absolutely. Right. So we're going to walk through that in this video. It's going to be great. I'm going to show you exactly how to write a care plan, my friends.
And then Harley was also asking, do they have to be a certain format? How long do they have to be? So Christina will walk through all of that on how to ace your care plans for nursing school. So those are all great questions. Christine will go through them. If you have any other questions about care plans as we go through this, go ahead and shoot them in the comments. And if we don't enter them while Christine is talking, we'll circle back around on them. Also, if you just have any other nursing school questions, go ahead and pop those down in the comments as well.
Pop those in the chat. Yes, they do have to be a certain format. And how long do they have to be? We will go over that. So perfect. Yeah, it's going to be great. Matthew's keeping a list of your questions. So post your questions and I will make sure to hit them all as we go, or as many as I can as we go. So that is really the biggest thing that you're going to want to do. First step is to find a care plan book. If it's in your bundle already, perfect. Who mentioned that? Someone mentioned that
Alexis mentioned that they're in our book bundle.
Yeah, so your nursing school might already require this book. A lot of them do because it's amazing. Literally writes your care plans for you. Not an exaggeration. And no, friends, I'm not trying to sell this book. It's just, this is what I used in nursing school. And I just didn't understand why other students weren't using it because it's great. So now that's the first thing that you're going to want to do. So when I say care plan, here's what I mean. I mean, you go to clinical or let's say if you're doing a case study or something online, VSIM, something, whatever you need to do a care plan on. You have a patient, whether it be a virtual patient or a real in-person, in real life patient. You are going to assess that patient and you are going to look at their history and you are going to look at how they're presenting to you and do your nursing assessment, your head to toe, most likely focus assessment, what have you. And then you are going to get or create this care plan that has multiple columns. Can you visualize this in your mind? Who is doing this care plan right now?
I'm currently doing
I'm currently doing a care plan now. Perfect. Is your care plan the multiple columns? Because that's what I mean by care plan. You have your nursing diagnosis. Then you have patient goals. And then you have nursing interventions, and then you have the rationale for those interventions, and then you have evaluation. That's your care plan. Diagnosis, nursing diagnosis, patient goals, nursing interventions, rationale for the nursing interventions, and then the evaluation. How did it turn out?
Yes, it is.
Perfect.
Hooray.
4-column care plan. So what Matthew is going to do, or what I'll have Matthew do, we have a template for you that's totally free for care plans. And we're going to drop that link in the YouTube chat here. But if you go to nursingschoolofsuccess.com/care plans, nursingschoolofsuccess.com/care plans, CAREPLANS. nursingschoolofsuccess.com/care plans. We have example care plans there for you. And then we also give you the template. So it makes it super easy. So just example care plans for you to use as inspiration. And then we have the template for you to fill out. So that's what we're going over today, the template. So NANDA nursing diagnosis is the first column. That's the first thing you have to do. Oftentimes it's the hardest to figure out. So that is a lot of where this book comes in. You need, like I said, the NANDA nursing diagnosis from this textbook. They are standardized. You cannot just make them up. They're standardized. So like, was it Charlotte? I think it was Charlotte. Where did I, they're individual to your patient's needs, right? Yes, they are. And this is where that comes in. When you have a patient with a particular disorder or issue or something, you will go through this list and you will find a diagnosis that relates to whatever problem they're having. So for example, let's say you have a pediatric patient come in and that pediatric patient just had an allergic reaction. There is a allergy one. Let's see. Risk for allergy reaction. That's a risk for diagnosis. So that's what you could use. If they were anaphylactic, it could be like ineffective airway clearance, something to that effect. So something respiratory, choose a respiratory diagnosis, choose a allergy diagnosis, but you will make it specific to your patient. Now, for example, that would be for an allergy situation. If you had a patient with like hypertension come in, would you give them a risk for allergy reaction diagnosis? Maybe if they were at risk for that, if they had other things that went into risk for that, but not specifically for their hypertension. Does that make sense? So you would make it specific to the patient. Now they could be, if they have cardiac stuff, there's cardiac ones like fluid imbalance, or where is it? I am looking for, hopefully they didn't take it out on me. There's one that is, there we go. Decreased cardiac output or decreased cardiac tissue perfusion. Decreased cardiac output. Risk for decreased cardiac tissue perfusion. So those are what you would look at for a patient with, cardiac issues. So you need to, Charlotte, exactly like you said, make it specific to the patient. You're not just going to choose random nursing diagnoses that don't relate to your patient, right? And now here's also where this book really provides you a lot of value. When you look at this green tab section in this book, do you guys see that? Green tab here? Green tab? It lists out common disorders or issues that a patient can have. And then it gives you nursing diagnoses that could relate to that, which is so fun, right? So you actually don't even have to think about it yourself. Of course, think about it. But it gives you a really, really good starting point. So let's see. I always like cardiac stuff. Cardiac stuff is fun. Oh, clotting disorders, risk for bleeding. So if your patient has a clotting disorder, risk for bleeding, so good. Let's see. What else we got? Cirrhosis, so liver cirrhosis, fatigue, nausea, that's great. Chronic pain, risk for bleeding, of course, risk for injury. So they give you, depending on what condition or issue your patient is experiencing, they give you possible or recommended nursing diagnoses based on that. So in this book, Nursing Diagnosis Handbook by Ackley and Ladwig, in that green tab section, that's the first thing you're going to want to look for. That, and then the front page to look at the actual list of nursing diagnoses. So that is step number 1. Figure out what your nursing diagnosis is. That's step number 1. Step number 2, you have to decide the related to factor. So let's talk about how a nursing diagnosis is structured. We're talking about the first column of your care plan, the nursing diagnosis. You have your NANDA nursing diagnosis, which is the one that you will choose right here. So just like we talked about. Risk for allergy reaction. That's one. What else did I say? I mentioned decreased cardiac output. So it's just whatever phrase that is. What is the NANDA nursing diagnosis? Just from this book. Like I said, you don't make them up. That's the first part of your nursing diagnosis. Now, the second part is the related to factor. R/T. Slash? Forward slash?
Slash.
R/T. Related to. R/T. Related to. Now, this is like, what is causing the problem? And when I say this, what is causing the problem? What I want you to do and think about is, what is the pathophysiology? What is the underlying cause? What is the physiology? What's the pathophysiology? Like, what is going on with this patient in their body? I'm not talking high level. I really want you to critically think and dig deep, because this is the problem we want to solve, right? This is the problem we want to solve. So related to factor would be the pathophysiology. So dig deep. What is the actual pathophysiology? What's happening? Now, the third part is the as evidenced by, or AEB. As evidenced by, or AEB. These are just the signs and symptoms that the patient is presenting with. That's it. I know we want to make the as evidenced by section really complicated, but that's all it means. As evidenced by AEB is the signs and symptoms that the patient is presenting with. Like, what do they have? Like, as evidenced by, like, they have this problem and this is what they're showing because of that problem. Like, it's as evidenced by. Here's the evidence for that problem. Does that make sense?
Yeah. Yeah.
There you go.
Yeah. See, I understand this.
If I can explain it to him, then I feel like I'm explaining it well. If he understands, we're good. So there you go. The NANDA nursing diagnosis, the related to factor, pathophysiology, please, and then the as evidenced by, or AEB, which is the signs and symptoms that the patient is experiencing. Now, let's walk through the care plan book and how you can find these things. And basically write your care plan in like 5 minutes. So good. So when you choose your nursing diagnosis from this book, then you will flip to the white section here, which has all the nursing diagnoses itemized.
And before we go into that, Tanya is just asking, is there a cheat sheet for this? So if you go to nursing-school-of-success.com/care plans, we have a template. We have some examples. We have more info there. So definitely go there if you need more information about care plans. But yeah, that's definitely a good place for the template and some other examples to go through. In addition to the one that we're going through right now.
Absolutely. I really like ineffective airway. That's one of my favorites. So let's do that one. I'm going to flip to this one. If you're following along in the book, it's on page 131. All right, ineffective airway clearance. So when you're looking at the NANDA Nursing Diagnosis Handbook, Nursing Diagnosis Handbook by Ackley and Ladwick, this is page 131, ineffective airway clearance. Now, how this is divided up is just like your care plan. They give you the NANDA diagnosis. They give you the related factor, related to factor. Then they give you possible as evidenced by signs and symptoms. They call it defining characteristics. Do you see that? So here, related to factor, related factor, then defining characteristics. So they literally give you a list, friends. It's like the best. So make sure that you're just following along. So related factors, defining characteristics. Of course, you have to make sure, Charlotte, like you said, make sure that it is specific to your patient. So if these don't apply to your patient, use something else. But it gives you a good starting point. So that is what you will do.
So that is part of the critical thinking, is you don't just like take this out and write it verbatim.
Right.
You definitely use this as a starting point and then apply it to your patient.
100%.
Okay.
Absolutely. Absolutely. So, you know, Foreign body and airway. Retained secretions. I like it. Perfect. Excessive mucus. Great. One of my favorites that we had a member submit a care plan to us, and she used the term impaired ciliary activity, something akin to that. Impaired ciliary movement or something.
I don't like when my ciliary is impaired. I'm just gonna say that. Do not like when my ciliary is impaired. Compared.
It was so great. I was so impressed. So there you go. Excessive mucus, foreign body. Yep, there you go. So dig deep into the pathophysiology for your related to factors. And then defining characteristics is just, it's just basically all the respiratory ones for this one. Like diminished breath sounds, right? Like labored breathing, dyspnea, ineffective cough, restlessness, a wide-eyed look.
Wide-eyed look.
Yeah. For sure. Restlessness yes. If you can't breathe, that would be it. So you just follow along in the care plan book. So easy. It's seriously, friends, I'm not even kidding you. Basically writes your care plans for you. Of course, critically think about it. Now, so that is the NANDA nursing diagnosis. Questions? Post questions about that in the chat if you have any questions.
Continue posting questions. I am grabbing them. Christine's going to continue going through the care plans, and if she doesn't cover it, then we'll circle back around on some questions. Also, Joe, thanks for the feedback that apparently those on Instagram versus Facebook, the sound is better on Instagram rather than Facebook. So if you want to hop over on that side.
Which makes total sense.
Which makes total sense because the phone that we're using the Facebook on is a little...
It's an old phone. It's an outdated phone. My phone is what we're using for Instagram. And it's not a new phone. I refuse to upgrade because I don't like any of the newer phones nowadays. I love my phone. I'm sticking with it.
And there's always YouTube too. So YouTube's coming straight from our computer. So
yeah, YouTube is the...
But anyway, sorry.
The best sound.
That is... that is the feedback from Joe. Thanks, Joe. So apologize for the sound on Facebook, but thanks for joining.
Okay, I want to answer Paula's question. Is that okay? Because
the one that says ha ha ha? No, that's not it.
That's not it.
All right, Paula's actual question. Okay.
Yes. So best way to prioritize diagnoses. So because we just talked about the nursing diagnosis, let's jam on this.
Okay.
I'm aware of the ABCs, but apparently there is news about CAB. And of course, Maslow's hierarchy. Would love to know your insight and clear some confusion. Thank you. Would there ever be a situation where you would prioritize a risk problem over another problem? Oh, so good. And it goes back to Charlotte's question of making it specific. Every patient's going to be different. Every care plan is going to be different because every patient is going to be different, right? So something for this patient is going to be different than what you do for another patient. But overall, a risk for diagnosis. So Paula, what if you're not super familiar with care plans, what Paula's talking about is there are some diagnoses, some NANDA diagnoses that are considered risk for diagnoses. So the patient doesn't have that yet, but they're at a risk for it. So one that I used was like a risk for allergy response or something. Risk for allergy reaction. So let's say your patient comes in and they are in anaphylaxis, they cannot breathe. You would put the ineffective airway clearance diagnosis. Like that would be a fit for them. Ineffective airway clearance. If their airway is closed up because, they can't breathe, they're having an allergy response, ineffective airway clearance. Now then you could put risk for allergy reaction. That still fits to the patient because they are at risk for another allergy reaction for sure. If they've had one before, they're at risk for another one. But you would prioritize that ineffective airway clearance above that risk for allergy response. Reaction. Risk for allergy reaction. You want to solve, the airway first. So you typically will solve actual nursing problems, nursing diagnoses, like problems that they have first, and then you will move on to the risk for ones. Does that make sense? Risk for diagnoses because they don't have it yet, they're just at risk for it, is not a high priority. That makes sense?
Yeah, so it makes sense that if their airway is already closed, you probably want to solve that before the risk of another allergy or the risk that they do have an allergy. So it's the most important needs first, or the highest problems first.
Absolutely. Absolutely. So just make sure that you are, and it's the ABCs: airway, breathing, circulation. You want to solve their airway first. Make sure that their airway is clear. Make sure they are breathing and that their blood is circulating. From my understanding, the CAB thing, CAB, is for the general public out there in the world. So if you are, not you, but a lay person is, doing CPR, what we're teaching now is that they need to start chest compressions immediately, which is, really the same thing in the hospital. But, we're in like a clinical facility with all the tools, right? We focus more on the ABCs. Out in the world, it's CAB. That's from my understanding. I could be totally wrong, but that is from my understanding.
That makes sense. Now, going years back when I did take a CPR class, not like in high school or something like that, but way back then,
back in the
day, we were still taught to check airway first, then clear everything before even starting chest compressions.
I remember that. Like the I remember that from like sixth grade or something, or like fourth grade when you took. Did you guys take CPR class in like elementary school? I remember that, or like middle school or something. I took a babysitting. They had like a babysitting class. When you would like start babysitting, you would take like a babysitting class that included some rudimentary CPR. And you had to do like the mouth sweep, which is not what you do.
No longer what you do.
Don't do that.
Things change. If I think back to my course, I'm pretty sure that approximately 5% of what we were told is probably something that you would actually want to do nowadays. So we learn. We learn more. So
funny.
Back then, ABCs for the layperson, but it's understandable for out in public for a layperson. Just start compressions immediately.
Yeah, because now
circulation.
Now they're teaching, and I think that switched from what I had heard. This was actually back a few years ago. They were switching it out because people were not doing the mouth to mouth stuff, so they just want the general public should just do compressions, just do compressions. You don't have to do the mouth to mouth stuff. Just do compressions. That had started to change a few years ago.
Just increasing the probability that someone will
do something. So So anyway, that's where that comes in. From my understanding, that's kind of the difference between the ABC and the CAB. If I'm totally wrong, let me know. I'll look into it. In England, we learn it in high school. Oh, you learn CPR in high school? Oh, that's cool. So like in your high school, you learn CPR? That's neat. We were watching a movie the other day. We were watching a movie, and it was choking is the word I was looking for. The girl was choking, but it was a story from like the 80s.
A long time
ago.
And
they didn't know what to do because like the Heimlich didn't exist.
So very, very interesting.
Yeah, it was just interesting to see how like medicine has changed. And when I was in A&P, actually, my A&P instructor said that medicine has a half-life of like 20 years or something. Like half of what we think is true now is going to actually be false in 20 years from now. Like as you just learn new things.
So talking about the Heimlich maneuver, back in when I was learning things that you should not do now, there was a really
disclaimer: don't do these things.
There's a really funny video that we learned in health class. This was middle school. Learned in health class, and we were learning about choking and the Heimlich maneuver and how to do a Heimlich on yourself.
Oh yeah, no, that's
how to do a Heimlich on yourself. And there was just this video. It's a priceless video of just a picnic bench or a picnic table, and that's all you see in the frame. And some guy just running into the frame and running like full bore into the
no, that's totally what you
table.
do. That's totally still legit.
Yeah.
Like you will basically like do anything to get whatever out of your airway that you can.
That's fun.
That's like, and seriously, like if you can't breathe, that's what you're gonna do.
Yeah.
So okay, there you go. Disclaimer. This we're just being nostalgic here. But it's kind of interesting to see how it all changes. So ineffective airway clearance, that is kind of the difference between ABC, CAB. I hope that was helpful, Paula. Okay, Paula, you said makes sense. Totally agree. Okay, I'm glad that made sense to you.
And for those just joining, welcome to the Nursing School Show. We talk about mostly nursing school topics. Sometimes we go and talk about nostalgic things like Heimlich maneuvers and outdated CPR methods. But for the most part, right now we're talking about how to ace your care plan. So this is Christina. She's talking about how to ace your care plan. I am Matthew. I talk about nostalgic things. All right.
I'm a nurse.
I am not.
Not a
clearly
nurse.
Not. So take that with a grain of salt.
I love you. You're the best. You make me so happy. All right. Ineffective airway clearance. So that's the difference between ABC, CAB. To my knowledge, let me know if I'm wrong on that. All right. So that is the nursing diagnosis. And when I say nursing diagnosis, it's those three key parts. The NANDA diagnosis that you will get from this textbook or from one of your other nursing school textbooks. They are standardized. Please don't make them up. The second one is the related to factor, which is the pathophysiology. What's the pathophysiology? What's going on? It's the pathophysiology. Number 3, as evidenced by AEB. As evidenced by what are the defining characteristics. What are the signs and symptoms that they're presenting with? Like, what does the patient, have that is evidenced for your nursing diagnosis, your NANDA nursing diagnosis? Does that all make sense? Can you guys please put a thumbs up?
Thumbs up if this is making sense.
This is making sense.
While you guys are doing that, I do have a quick question about that. Because care plans, we were talking about AEB as evidenced by, you said that's basically signs and symptoms. In the book, it's called defining characteristics. In your care plan, doesn't matter what you put in the column header for that area.
Yeah, so we're still talking about the first column.
We're still talking about the first column.
We're still talking about the first column. So when you do a nursing diagnosis, it's those 3 parts. It is ineffective airway clearance related to excessive mucus as evidenced by labored breathing, restlessness, decreased respirations of, what have you. All those things, anything that your patient is presenting with that is evidence for that nursing diagnosis. Does that make sense?
So should you put, is that term AEB part of the care plan?
Yes.
Or so you have to use AEB. You can't just put signs and symptoms, even though that's kind of what it is.
Right. You would put as evidenced by or AEB.
Or you don't put defining characteristics, even though that's what's in the book.
It's AEB.
Yep,
it's AEB. And if you guys are at all confused on how this looks, please go to nursingschoolofsuccess.com/care plans. CAREPLANS. We have we give you example care plans that walk you through, kind of examples, get your creative juices flowing. And then we also have a blank template for you to follow. And then I also have this listed out on, it's kind of like a how-to. I have a how-to guide on there too for you. So that'll help.
And then what's the book that we're going over right now?
This is the Nursing Diagnosis Handbook by Ackley and Ladwig. I highly recommend it. Okini on Instagram. I really, really recommend this book because it basically writes it for you. There's no other way to say it. There's no 2 ways around it. It has the full list of NANDA nursing diagnoses for you. Regular nursing textbooks oftentimes don't have that, which is kind of weird, but they don't. So you really need a book. You really need another book. Charlotte, a risk nursing diagnosis would it have any AEB because it hasn't happened yet? No, it would not. Perfect question, my friend. Perfect question. So yeah, it's a risk for diagnosis, but wouldn't have any. Well, okay, let's go to risk for bleeding as examples.
And Erica, I'm not sure whether the book is only available in the States. I am unsure of that.
Yeah, so this only no, it's on Amazon. This is on Amazon.
Amazon's probably everywhere.
Amazon's everywhere, right? Not everywhere, but for the most part everywhere. So when you look for your risk for nursing diagnoses and go through the books, no, you wouldn't. It doesn't have, because there's no signs and symptoms that the patient is, risk for bleeding, risk for, there's no signs and symptoms that they're presenting with. So that is the first column. I was going to say Amazon. This is the first column of your nursing care plan. Now, the second column, let's go back to ineffective airway, 131, if you are following along. 131, the second column is patient goals. So what are the goals that you have for this patient to overcome that nursing diagnosis, improve, get better, all those things. We want good patient outcomes, right? So what are the patient goals? What are the patient's goals? Now, this is going to be written. Here's where nursing students get confused. This is going to be written as the patient will. Start with that phrase. The patient will. The patient will, da, 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 da. So come to your care plan book, or just think of these up as you go. That's fine. You don't need this care plan book if you really don't want to. That's totally fine. The nursing diagnoses will be in a lot of your textbooks. They just might not have the full list, which is kind of a bummer. But if you come in here to your care plan book, it's client outcomes is what they call it. So this, the client will, I say the patient will. So this is written as the patient will. Now, these are basically SMART goals. SMART goals. Now, here's where I'm going to defer to Matthew because I always get this wrong. Specific, measurable, achievable, relevant, and time-bound. That's one way. There's like various ways to do it.
There's different ways. I'd say that that's probably the most common.
Yeah. Okay. Yeah. Specific, make sure it's specific to the patient. Measurable. It has to be measurable. Put like a time frame on it. Put a number to it. Make it quantitative. You have to be able to measure that they got to a goal. Measurable. SMA, attainable. Is it attainable for that patient? Attainable is the one that I think kind of
fluctuates. The A kind of fluctuates because it's kind of the same as measure, or it's kind of the same as some of the other ones. But,
like specific, but attainable. How do you spell SMART? SMAR. Relevant and attainable. I don't know. Yeah. Relevant and time bound. Make sure it's time bound. There's a time limit to it. So SMART goals, achievable, perfect. SMART goals for your patient goals. Specific, measurable, achievable, relevant, time bound. Because I can spell SMART. There you go. Make sure your patient goals are written in that way. So, and they have to be like the patient will. The patient will, da, 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 da. Now, if you come over to your care plan book, it's client outcomes. So specifically for ineffective airway clearance that we've been working with, demonstrate effective coughing and clear breath sounds. Maintain a patent airway at all times. Perfect. The patient will explain methods useful to enhance secretion removal. Ooh, that sounds fancy. That is fancy. I am not that fancy when I write care plans for nursing school. But, make it your own. Make it your own. So those things. What will the patient do? What is going to help the patient get better with their nursing diagnosis? Like improve their condition. Does that make sense? Patient goals. That's all it is. That's all it is. It sounds like when you're sitting in nursing school class, it sounds harder than it actually is. And it's not that hard. It's just that. Now, the next column is nursing interventions. What are you going to do as the nurse? As the nursing student? What are you going to do about it? Now, this is written as the nurse will. The nurse will, da, 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 da. The nurse will. Or if you want to say the nursing student will, da, 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 da. Now, these are things that you are going to do, whereas the patient goals were things that the patient will do. Now, these are things that you will do as the nurse. What will you do as the nurse to help the patient reach that goal? What will you do as the nurse to help the patient reach that goal and get better with their whatever's going on, right? Ineffective airway clearance. So Here we go. So down here in the care plan, it's nursing interventions, suggested NIC interventions, nursing interventions classifications, suggested interventions, airway management, airway sectioning, cough enhancement, those things. Then, and you don't have, like I said, you don't have to use the things from the book. I would, you make it up. Some of these are so fancy. I'm not fancy, just.
So definitely the nursing diagnosis, can't make that up, but these things down the line, you can
yes.
make it specific to your patient.
Yes. Make it, applicable, relevant to your patient. That's a SMART goal, right?
Mm-hmm.
Make their goals patient specific. Make the nursing interventions patient specific. Like, what will you do? The nurse will encourage the patient to cough 3 times a day.
So I am allergic to peanut butter, so the patient will stop eating peanut butter. It's probably.
Yeah. I mean, really,
I'm allergic to peanuts.
Yep.
And when I was younger, people would say, "Hey, what happens if you eat peanut butter?" And I'm like, "Oh, let me show you." So probably not the smartest thing to do. So
that's great. Yes, the nurse will educate the patient on the importance of avoiding allergens.
Wow, that's fancy.
That did sound kind of fancy.
The patient will not go and say, "Hey, let me just try it out and see what happens."
Right. Yeah, so you just really, it doesn't need to be fancy. Doesn't need to be fancy, but, just make it specific to your patient. And then the next column, so what? 1, 2, 3, 4. Column number 4 is rationales for your nursing interventions. So why did you choose those nursing interventions? Now, this is what we call evidence-based. Evidence-based. EB. Evidence-based. So people get confused. Evidence-based rationales. I'm going to say rationales. Yeah, it cracks me up. This goes back to like medicine has a half-life of 20 years. What is the evidence that we have now that supports your nursing interventions? So you'll go through your nursing interventions. So this is actually really one of the beautiful things about this care plan book is that they give you nursing interventions and then the rationales for them, the evidence-based rationales for them. So it literally gives you the answers, my friends. Now, I am not saying that you copy things from the book. No, I'm not saying like directly copy things from the book. You have to critically think about it. You have to apply it to your specific patient situation, but use this as a guide. This will really help you understand care plans better. So, for example, nursing interventions, auscultate breath sounds every 1 to 4 hours. And then it has the evidence base. This was just that. In severe exacerbations of chronic obstructive pulmonary disease or COPD, lung sounds may be diminished or distant with air trapping. And then it has the Bickley and Zalagi 2017. So it has the actual
that's
reference
the
for you. That's the evidence. So that's what you'll write. You'll kind of paraphrase that and put the reference there. Bickley and Zalagi?
Yeah.
Am I saying that right? 2017? Yeah. So anyway, it's in the book. It's in the book for you. So it has the nursing interventions and the rationales. It has to be evidence-based practice, EBP rationales. That's what's required. And then the final column, number 5, the 5th column of your care plan columns, right? Nursing diagnosis, patient goals, nursing interventions, rationale for your nursing interventions, and now we are on to evaluation. What happened? Did the patient meet their goals? Did they not meet their goals? Did they kind of meet their goals? That's what you will say. If they met their goal, great. Write what they did and write what their next steps are. If they didn't meet their goals, write why and what you're going to change about the care plan, how what's going to change to help them meet their goal. If they kind of met their goal, same thing. What did they do? What did they meet? What didn't they meet? And then what will you change to help them meet their goal. And that's your care plan.
5 columns.
5 columns. There you go. If you need a column, if you need the care plan template, we have one for you for totally free. NursingSchoolOfSuccess.com/care plans. CarePlans.
There are some examples in there and the template, so you can take a look at that as well. That kind of segues. Charlotte was actually asking, is there a website you would recommend to find case studies to practice writing care plans? That's a good idea.
That's a fantastic idea, Charlotte. I don't know off the top of my head, but if you find one, please let me know.
Yeah, that's a really great idea.
Because I would be very interested in that. Absolutely.
Okay. If you guys have any more questions regarding care plans, we'll go through some questions that were brought up, but any more questions that we did not answer, go ahead and write them down, pop in the comments, and we'll get to them.
You know what we should do? Can we do a screenshot? Can you guys screenshot this book? Please. Screenshot the book. Screenshot the book.
Here it goes.
Right now.
There it goes.
Screenshot. Nursing Diagnosis Handbook by Ackley and Ladwig.
Okay. Alita was also asking, as a nurse, I know we have to write care plans for the patient. How is that done at work? In school, we are doing plans, but virtually making it up as we go because they don't have real patients. So how does it work?
Oh, you don't have real patients?
Real world.
Oh, yeah, if you're online and stuff.
Yeah.
So the thing that I think people get really confused on with care plans is that it's the nursing process. Did you notice? So what's the nursing process? Assessment, diagnosis, planning, implementation, evaluation. Assessment. So you assess your patient. Diagnosis, the nursing diagnosis. Assessment, diagnosis, planning. Planning is the patient goals. What goals do you want your patient to achieve? What are you going to plan for those patient goals? Christina can't spell smart, and Christina can't spell ADPI in her head. Assessment, diagnosis, planning, implementation is the nursing interventions. And then evaluation is evaluation. Thank you, Charlotte, for posting it so I can see ADPI. ADPI. Okay, yeah, actually, Charlotte, you added the O. So, Charlotte, you're in England. I didn't know that. So, in England, do you use the O? Because not every nursing school here in the States, in the United States, uses the O. It can be O, add OPI, or it could be ADPI. So assessment, diagnosis, planning, implementation, or evaluation, or it could be add OPI, assessment, diagnosis, outcome, identification, planning, implementation, evaluation. Outcome identification. So goals. There you go.
Goals. Yep. When are you guys planning to take your NCLEX? Never. Not a nursing student, not a nurse. Already a nurse, took it already.
Yep. Already a nurse.
But everyone else in the comments, feel free to comment as well.
When are you taking
when you guys taking NCLEX? How far are you guys along in nursing school?
Yep, I would love to know.
All right. Alexis is asking, is there any video that we have on concept mapping, or would you feel like a concept map is filled out the same way?
Concept mapping is totally different than the care plan. Concept mapping, like a concept map for your, anything you're learning in class, really, fluid electrolytes, fundamentals, med surge, anything like that. That's where you're going to just take the concepts around and map them together, connect the dots between the different disorders and signs and symptoms and all that stuff. That's a concept map. This is a care plan, which walks you through the nursing process. That's what it does. It walks you through the nursing process. I'm going to end there.
So different concepts. Chatty. Different concepts. Definitely different concepts.
Different concepts. They're two very different things. Now, if you go to NursingSchoolOfSuccess.com/care plans, we have a care plan template for you to follow, make sure that you're actually doing it right. Like I walk you through it. Makes it so easy. So please, please, please go to NursingSchoolOfSuccess.com/care plans. And that'll be sent to you guys.
Alita, the care plan paperwork you guys have was not that clear. Yep. So that's clear.
Yeah.
Hopefully that's clear.
Yeah. Sometimes in school, like they don't really explain it, the care plans. So that's what we're here for you. I remember doing my first care plan and it was on, get this, constipation.
I do not like that.
That was my care plan. My first ever care plan was on constipation and it took me weeks. And we did it with a partner.
It's a long time to be constipated. Just saying.
That was my first care plan and it was rough, friends. I gotta tell you, like when you start care plans in nursing school, I totally get it. Give yourself grace. It gets better. I promise you it gets better.
Keep practicing.
Keep practicing. The care plan book will help. Get it on Amazon. It's kind of the best. It's kind of the best. I gotta tell ya.
How do you differentiate signs and symptoms, and is this important in making nursing care plans? I'm guessing is what NCPs
good job,
are. Hooray!
NCP, nursing care plans.
I just guessed at that one. Also, since anxiety can be subjective because it's verbalized, how can it be observed objective?
Oh, such a great question.
Wow.
Thank you for bringing this up, Paula. Paula, right on with the questions today. Right on. Charlotte and Paula, I really like your questions. Okay, so this is a great question. If your patient verbalizes something, that can be subjective, like pain. Pain is a subjective experience, right? Your pain might be different from my pain, different from someone else's pain. It is subjective. If the patient verbalizes like anxiety, like my anxiety is different from your anxiety, which is different from your anxiety, someone else's anxiety, you know, it's a subjective experience. So what you would do is on your nursing care plan, you would write patient reports or patient verbalizes this. Patient verbalizes or patient states pain is 6 out of 10. Patient states pain is 3 out of 10. You know, patient states, direct quotes, severely anxious. Or patient states, this is the most anxious I've been in my entire life. That is what you would write on your nursing diagnosis for your as evidenced by. Does that make sense? There you go. How would you differentiate signs and symptoms? And is this important to making nursing care plans? Differentiate signs and symptoms. You want to make sure that the signs and symptoms is applicable to the diagnosis. So for example, like we kind of used an example before, I'll use the same example. If you have a pediatric patient come in, actually that was a different example. If you have a patient, an adult patient come in with hypertension, you wouldn't necessarily write anything about an allergy stuff unless it was applicable to that nursing diagnosis. You know, if your patient has a nursing diagnosis of like decreased cardiac output, you wouldn't write like patient says, I get peanut or I'm allergic to peanuts. Like you wouldn't write that as your defining characteristic or as evidenced by if it doesn't apply to your NANDA nursing diagnosis. Like they have to match, right? Does that make sense? I hope that makes sense. Does that make sense to you?
Yeah.
If it makes sense to you, then I'm cool with it. I'm cool with it.
So Alexis is just giving us a little bit more background. So that's really interesting, just to get you caught up. She says that we do concept mapping on our patients. We do a concept map, CAS sheet, anecdotal, and a diagnostic write-up sheet and intervention sheet. We fill our concept map out similar to the care plan. So
we say that again.
We fill our concept map out similar to the care plan.
Yeah, I could see that. I could see them going hand in hand, which they for sure do, because you would need to write like pathophysiology. Here are the signs and symptoms, the nursing assessment, and the nursing interventions, compare it to all the things. And then from that concept map, you kind of fill in your care plan, but they're two different things. Does that make sense? So that's what I think you're saying, Alexis. Alexis, you are on top of it. Perfect.
Oh, and Kimberly, for my care plan, I have to state both objective and subjective data. Would pain 1 out of 10 go under subjective? My instructor put it under objective. Any reason for that?
pain is one of those things that you could, it is interesting with pain. I've seen it done both ways. My guess is the reason that your instructor is putting it under objective is because it's a scale and there's a number attached to it.
And a face. Like the little,
or a face.
Yeah, the little crying face from 1 to 10. Scale. It's like really happy. It's like 0, and then like really, really cry at 10.
Yeah, if you're using the faces scale, or if you're using the numerical scale, that makes it more objective. But I would put it as subjective, personally.
I think that it is definitely more subjective
because it is subjective in my mind. But I don't think that's anything that would like fail you on your care plan. So ask your nursing instructor specifically, do it how they want you to do it.
Mm-hmm.
And then when you get to the real world, you can put it as subjective. If you want. Yeah. But usually pain, if you look at like Epic charting, right? Pain is there. It's in like, it's in like the vital signs, so it's like there, you put a number to it. So it's more objective because there's a number to it. Does that make sense? I hope that makes sense. There you go. There you go.
And going back to another example, then anxiety, there's really no scale of anxiety. So that would definitely be more subjective.
Yeah, subjective. Yeah. I mean, no scale that I'm aware of. Yeah. That would be more. Like I said, like this is like just the quote, like patient states, this is the most anxious I've been in my life. And you would put quotes around that, like anything that your patient says, quotes around. Yeah. Sweet. Great.
Those are really great questions. Any other questions regarding care plans? I do want to hit this one because I know that you'll like this question. It was from a little earlier, more general to nursing school in general, but I am an ESL student, but I really love to work in the medical field. Please help. How should I do, or how do I go about doing this? So even if you are an ESL student, that doesn't stop you at all. You can do it. A lot of it is something that we talk about a lot on our channel and on our videos. It's a lot about mindset.
Absolutely.
So definitely find a way to switch that mindset around. And yeah, if you want to work in the medical field, then go ahead. You can do it. Did you have anything to add to that, or?
Yes, I do. I always do.
All right.
Here we go. If someone tells you you can't do something, you get to decide if that's true or not for you. Just because someone says it doesn't make it true. Just because you say something doesn't make it true. Whoa. Play that back again. Just because someone tells you something doesn't make it true. And just because you tell yourself something doesn't make it true. So if someone tells you that you can't pass nursing school, doesn't make it a fact. It doesn't make it true. Just because you tell yourself that you can't pass nursing school, doesn't make it true. Doesn't make it a fact. You get to do whatever you want, friend. That's what free will is all about. You get to do whatever you want. You can do whatever you want. You can pass nursing school if you want. You can go to another nursing school if you want. You can fail nursing school if you want. And then you can go to another nursing school if you want. It's totally up to you. But if this is your dream, keep going. Don't let anybody bring you down. Don't let anybody tell you that you cannot do it if that's not what you want to believe. That's it. There you go. Wise words. Perfect. I'm glad you found those wise, Paula.
Wise words.
I do like that. Just because someone says something doesn't make it true. And by extension, just because you say something doesn't make it true. So if you are telling yourself that you're a failure, if you're telling yourself that you can't do it, if you are telling yourself that it'll never happen, it doesn't make it true. It just means that your brain is just doing its thing. Fact. You still get to decide what you want to do. And if you want to succeed in nursing school. That's all.
Awesome. All right. Well, we got...
Take that on a Wednesday. Oh, wait, it's not Wednesday. It's Monday.
It's a Monday. It's Monday all day today.
I thought it was a Wednesday. I've been thinking it's Wednesday through this whole AMA.
Wow.
I was like, wow, happy Wednesday, you guys.
Happy week. Happy week.
Monday.
Happy day. Good day to you.
Okay.
We have another question from Care Plans from Instagram that we wanted to get to because Instagram will probably cut off at the hour mark, which is coming up. So want to make sure we answer it really quickly. What is the time frame you should put to meet the goal? I've been putting by the end of my shift, and I was told that that was not specific enough. 20 seconds.
It depends. It depends on what the goal is. If the goal can be met earlier, do it earlier. I would go with whatever your instructor wants you to do, because I typically would do at end of shift. That would be cool for me. But if that's not cool with your instructor, do it however they want you to do it. So, all right, Instagram, we only got an hour with you. See you later.
Yeah.
That's it. You know, just do basically, here's what you guys got to do. You've got to write care plans after care plans after care plans after care plans. Get feedback from your instructor. Take that feedback, change your care plans. Write more care plans. Get feedback from your instructor. Write more care plans. And you will get better and better and better at them. And then you also just have to make sure that you are doing it as the instructor wants you to do. They are the one grading it after all.
Yeah, it is definitely to get yourself comfortable in doing your care plan. So as with anything in nursing school, practice until it becomes more second nature.
Yep.
Yeah, and I think that'll help. There are some gray areas that we've been talking about. What goes under objective and subjective with pain. So go with what your teacher wants.
Yep.
And again, it's just to kind of get the feel for it and to practice more. So I think
100%. Absolutely.
Does that make sense? Yeah.
Go rock your care plans, my friends.
All right. Well, we will see you on Wednesday, the real Wednesday this week, not the fake Wednesday of today.
Sorry.
Happy Monday, guys.
Happy Monday. I hope you guys have a beautiful rest of your week. If you need any more help with care plans, go to nursingschoolofsuccess.com/care plans. nursingschoolofsuccess.com/care plans, CAREPLANS. We have a whole care plan template for you, example care plans for you to draw inspiration from. There's actually a template care plan that I give you exactly what goes in what column, and I walk you through how to do it, which is just so helpful. So please, please, please go check that out. It's going to help you a ton.
All right. And check out the book too.
Nursing Diagnosis Handbook by Ackley and Ladwig. There you go.
And we will see you on Wednesday.
We'll see you on Wednesday, friends.
All right. Take care.
Take care. Bye.
Bye.
Yay.